All right, I want to talk now about the coronavirus pandemic. Case counts and hospitalizations continue to fall, and new research is showing that double masking or wearing a surgical mask seriously reduces the odds of transmission. We're joined now by Dr. Heather Yo, SurvivorNet medical advisor and associate professor of surgery and healthcare policy and research at Weill Cornell Medical College. Doctor, always great to have you with us. I want to start on that point of double masking. It seems like the hot new trend lately in this pandemic. I'm wondering if you think that everyone needs to be double masking all the time at this point.
I mean, I think that the CDC just recently recommended it because there's clear evidence that a mask that fits better is more likely to protect you. I think that if you have a good fitting N95, you don't necessarily need to double mask, but for many people, they don't have access to well-fitting or sized or fitted masks. And so double masking is a reasonable alternative.
Now, it used to be that we heard that, people shouldn't actually go out and buy these surgical masks because they should leave it out there on the market, for frontline workers, for essential workers. Should everyone really start purchasing those masks and say, hey, are you saying that, cloth masks, they're not good enough? Everyone needs to go out and try to purchase those N95s.
I think the recent study they did that said that double masking is about as effective as the N95 fitted masks. And so I think it's whatever's available. I mean, as a resource now at hospitals, we have reasonable access to N95s. And I think that if people use an N95, it's fine. It's just they need to be cautious of how they use them. N95s actually can last for a couple of days. And for many of us, when we were early in the pandemic and didn't have access to masks, many of us would have 3 N95s and rotate them as long as they would last us. So I think that we have definitely more resources now. So I think for individuals, whatever they can get their hands on is probably the best thing.
How quickly should folks be getting rid of their masks? How many times can you wear one?
I don't know that there's clear evidence. I think if the mask is soiled or dirty, if you know that you've been exposed to someone with active COVID, you should probably consider changing the mask. I think that a mask, realistically, as long as it's not soiled, can be used for at least a week.
All right. Well, then I need to get rid of some of my masks, I'll be honest. And I know some of my friends do as well. As I mentioned, we see case counts falling, hospitalizations are falling. However, I was reading some of your notes and some of your thoughts before we had this chat, and you say that, ICUs are still full. Would you say that we are nowhere near close to out of the woods yet? Because it seems as if we're rounding a corner, so to speak.
I mean, as clinicians, we're very happy to see the numbers going down. But as you know, the numbers of cases, actually, the numbers of deaths and the numbers of hospitalization lags that a little bit. People get sick and then may not initially need to go to the hospital. And as those patients are in the hospital, our beds continue to fill up. And so in our ICUs, patients are often in the ICUs for weeks to months. And so even though we're discharging, or unfortunately some patients are passing away, we are still kind of constantly slowly building. And in New York, we're at numbers very similar to where we were in April in terms of hospitalizations. And so we're still being very cautious. We're having to hold off on some elective surgeries at this point.
We had drug maker Eli Lilly receive emergency authorization for their antibody cocktail to treat coronavirus. Considering that we have this news and we have the vaccine, which it has been speeding up how many people we are vaccinating, do you think that we're going to, much more quickly beat this pandemic now?
I think that the most important thing is to be getting the vaccine out there in as many patients as we can. I'm excited about the availability now of the Eli Lilly antibody cocktail. There's a couple of caveats with that. Unfortunately, the use limitation is pretty small. I think we've talked about it in the past before. It's really not indicated for patients who are hospitalized, those on oxygen, or those who have baseline needs for oxygen. In studies, actually, so far, it hasn't been shown to have any improvement in that cohort, which is probably those that need some treatment the most. It has shown in recent studies that it has about a 70% decrease in need for hospitalization and in deaths for patients in the kind of mild to moderate stage who have high comorbidities. So those who have or obesity or who have diabetes, some underlying conditions and who are at high risk to progress, those are our target patients, but has to be used early in the first 10 or so days of their diagnosis and before their symptoms get too bad.
As you're looking out, into the future, looking at March, April, May, into the summer months, what are some of your biggest concerns about this pandemic? We keep hearing fears about a potential resurgence or another spike.
I mean, my biggest fears are, and you see it around you, people are getting tired of isolation. People are getting tired of wearing masks. And my biggest fears are people are going to kind of think things are better so that they can be more lax. And I think, it's very easy when you're not in a hospital every day and you're not seeing the sick patients to say, oh, the numbers are going down. It's safer. It's better. I can start relaxing my restrictions. And that's really where, as physicians, we're worried that if that happens, then things can get worse again.
Dr. Heather Yo from Weill Cornell Medical College, thank you so much for joining us as always.